Hello, I'm student Dr. Huda. I'll be taking care of you today.
How you doing?
Doing well. How about you?
Good.
So what brings you in today?
I was working and I fell off the ladder and my heel hurts really bad now.
Okay. And you said this happened this morning?
Yes, so this morning I was painting and then fell
Okay.
down.
And can you point to where you feel the pain?
Yes, right here.
Okay. And when do you feel this pain?
It's honestly like always there. It's like a sharp pain that I'm having.
So you're not able to put any pressure on it at all?
No, I'm not.
All right. And how would you describe the character of this pain?
I would say it's like a really sharp, crushing pain that I'm having.
Okay. All right. And is there anything that makes it feel better or worse?
No, it's just really hurting kind of bad.
Got it. And does it radiate up your leg at all, or?
It's pretty much just here all in my heel, just localized.
Okay. All right. And you said this started this morning, and you can't put any pressure on it, so it's just been consistent pain since this morning.
Mm-hmm.
If you were to rate this pain from 0 to 10, 10 being the worst pain you've ever felt, what number would you give it?
I'd put this at an 8.
8? Okay. All right. So we're gonna go into your history a little bit now. I'm just gonna ask you a couple questions about your medical history. Have you been hospitalized recently?
Never.
Never? All right. Up to date on all immunizations?
Yes.
Any chronic illnesses?
No illnesses.
Are you taking any medications?
No medication.
All right. Do you have any allergies to anything?
No allergies.
Okay. Have you had any blood transfusions?
No transfusions.
Okay. Patient is alert and oriented ×3. So now we're going to get into your social history. Once again, I'm going to ask you a few questions. If you don't feel comfortable answering any of the questions, feel free to stop me at any time. So, are you in a relationship right now?
No relationship.
No relationship. Are you sexually active?
No, I'm not.
No? Okay, good. Can you describe your sleep habits?
I get about 8 hours of sleep a day.
Great, that's perfect. And you smoke at all?
No smoking.
Any drugs?
No drugs.
Any alcohol?
I don't drink.
Okay. And you said this happened at work. What kind of work are you in?
I'm just like a construction worker. I do a lot of painting. as well.
Okay. So you were painting and you fell off the ladder.
Yes.
Got it. Can you describe your exercise habits?
I try to go to the gym at least 4 times a week.
Okay, that's good. And how about your diet? Can you describe that?
Diet's very balanced and healthy.
Great.
Yes.
Any pets?
No pets.
Are you married?
Not married.
Okay. And have you traveled anywhere recently?
No traveling either.
All right. All right. So next we're going to get into the physical exam. Is it okay for me to put my hands over?
Of course.
All right. So we're going to start with the dermatological exam. So I'm just going to examine your legs for any hyperkeratotic lesions or xerosis. Check underneath, make sure everything looks good here. No abnormal masses or tumors noted, nothing like that. Okay, so we're going to check your interdigital spaces, make sure there's no macerations at all. Looks good bilaterally. The toenails look good, they look healthy and intact. All right, so next we're going to get into the vascular exam. So I'm going to evaluate your pulses. So first we're going to start with the dorsalis pedis. 2 out of 4 bilaterally. And the posterior tibialis. 2 out of 4 bilaterally. And then we're going to do the popliteals. That's also 2 out of 4 bilaterally. Next, we're going to evaluate the turgor of your skin. Looks within normal limits. I'm going to evaluate the temperature of your lower extremity. Looks good, going from warm to warm. Positive hair growth is noted. We're going to check to see if there's any sort of pitting edema. None is noted. Next, I'm gonna do a quick Homan's test. So do you feel any pain here in your capillary arm squeezing?
No pain.
No pain, that's good. No pain here either?
No pain.
All right. And lastly, we're gonna check your capillary filling time. Less than 3 seconds. All right, less than 3 seconds bilaterally. So next we're gonna do the muscular exam. So what I'm gonna do is put pressure on your feet. You're just gonna try to resist and push against my hands, all right? So you're gonna push down. Great, 5 out of 5 strong. Good, 5 out of 5 strong. Good, 5 out of 5 strong. And good, 5 out of 5 strong. All right, next we're going to evaluate your foot and ankle joints. So I'm going to start with the subtalar joint. Looks within normal limits here. Subtalar joint within normal limits on this side as well. We're gonna do the ankle joint. Looks good. And looks within normal limits bilaterally. We're going to evaluate the mid-tarsal joints bilaterally. And they look within normal limits. And last but not least, we will evaluate the first ray range of motion. Looks good bilaterally. Alright, so next we are going to do the Silverskoi test. So this is going to tell us if you have any equinus. So I'm just going to dorsiflex here. Great, and now I'm just going to flex your knee. And we're going to dorsiflex. Looks good there. And we're going to do the same thing here. Alright. And once again, looks good there. Alright. So now we're going to get into the neuro part of the exam. So the first thing we're going to do is a monofilament test. So this is not needles, not sharp. This is what it feels like. If you can scoot back a little bit, I'm going to ask you to close your eyes. I'm going to press this on your foot. You're going to say yes every time you feel it.
Yes. Yep. 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 Yes. 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 Yes.
Great.
Yes. 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 Yep.
Perfect. And where was that last one?
On the top.
Perfect. Alright, next we're going to do vibratory sensation. So what I'm going to do is place this here on your bone. You're going to tell me once you feel the vibration and once it stops. I'm going to have you do that with your eyes closed. Ready?
Feel it. Off. Feel it. Off. Feel it. Off. Feel it. Off.
Now we are going to do something called the Sharp-Dull test. So what I'm going to do is once again have you close your eyes, but this time you're going to tell me if you feel the sharp or the dull.
Right. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Perfect. Next, we're going to do a quick proprioception test. So I'm going to once again have you close your eyes. You're going to tell me which toe I'm touching and which direction I'm moving it in.
Got it.
Alright.
Big toes up. Pinky toe up. Big toe down. Big toe down. Pinky toe down. Big toe up.
Great. Now we are just going to go through your reflexes real quick. So first, we're going to do the Babinski test. Good. Good, no fanning of the toes noted. Next, we're going to have you test your patellar ligament. Good. And good. And then last but not least, we will do your Achilles tendon. Good. And good. Alright. So after evaluating you through my exam and based on your history, I'm led to believe that you have a calcaneal fracture. Basically, the calcaneus is a bone, the bone of your heel. So it could either be that, or there is a chance that you actually have a talus fracture, which is the bone that makes up part of your ankle. And we're also slightly concerned about your Achilles and the soft tissue area around there. We believe that it could potentially be injured as well. So what we're going to do today is dispense 800 milligrams of ibuprofen, which you're going to take 3 times a day. We're going to have you go in for an x-ray and an MRI to get a further look at everything that's going on in there and try to find the cause of this pain, so that we could deal with it properly. And lastly, we're going to have you put into a total contact cast to completely offload any pressure from your foot so you don't further injure this. Going off of that, you're also not going to be able to work for at least a few weeks. Do you have any questions about anything?
I do not.
All right.
All right. Thank you.